sorry, Mr. Wright, but you tested positive for HIV.
What?
The normal T-cell count is anywhere between 500 and 1,500. Right now, your T-cell count is 14.
But I ain't no
That is the crushing news delivered to Eazy-E, played by Jason Mitchell in 2015's Oscar-nominated Straight Outta Compton. Welcome back.
I don't even feel that bad, Doc. Don't tell me that.
That news rocked the culture, and today, Black Americans are still being disproportionately affected by HIV and AIDS. The Center of Disease Control reports that Black people account for 13% of the U.S. population, but have the largest share of HIV diagnoses. So what's behind the spike? Here to hash it all out, Black AIDS Institute Chair, Ms. Grizel R. Howard, Senior Advisor for Chief Medical Office, Cedric Polium, and sexual health expert, Dr. David Malbranch. Welcome to the show. Let's specifically talk about some data. These numbers are continuing to increase. Why do you think it's continuing to spread between our communities?
I think some of the factors weighing heavily really looks into, thinking of social determinants of health, right? When we think of just pure access to healthcare, location, how long it takes distance-wise, the communities that we see Black people residing in are food scarce. They don't have like nutritious food options. Just thinking about accessing healthcare, getting an HIV test, an STI test, going to see a provider at a clinic or a hospital, those are things beyond them just trying to live their life every single day.
One of the things we've learned from COVID in a kind of accelerated fashion is that these things don't happen overnight. And when you drop a virus into social inequities that have gone on for decades and centuries, it just explodes.
COVID is what I say with having such an esteemed panel, especially Dr. Malbranch. COVID has actually been very, very good to us in a way. Why? COVID, if we allow it, is HIV for the planet. However, we haven't stigmatized COVID yet.
Wow.
HIV is still stigmatized. So even before we get to the social determinants of health, for the majority of the community, HIV will become a chronic disease, as diabetes, hypertension, and others. However, in our community, we haven't received the right messaging.
So if you look at a lot of the studies, you'll probably see only about a third of people, like 33%, report using condoms consistently. And if you tell me you don't use condoms, my job isn't to be the condom police and then just suddenly judge you and stigmatize you, say, you need to wear a condom. I say, okay, so you don't use condoms. So tell me a little bit about your STI, your sexually transmitted infection practices. Tell me a little bit about how often you get HIV tested. And then also tell me what else you're doing to prevent HIV, since you don't like condoms or you can't use condoms.
There's the stigma of HIV. There's also the stigma of being Black in America. When those two overlap, what are we really dealing with that we need to really address as a community?
There's sex stigma, right? So when people are stigmatized for not fitting in those neat boxes that are considered the norm, that's where it starts and can kind of lead down a path with HIV.
Church communities, faith-based organizations, some have been a part of the epidemic and the work from the beginning 40 years ago, but some are still completely discriminatory regarding doing HIV talks or being involved and involving their congregations, because we know how significantly important not only education, but faith in church lies within the Black community.
Right.
As we break down the stigmas, let's also break down the myths that have been there generation to generation.
I mean, a lot of people still think that you can get it from mosquitoes, you can get it from kissing, you can get it from saliva. If you sit on toilet seats, share the same utensils, use the same plates. One of the myths is that it's just a gay thing. So one of the things that I commonly hear from a lot of heterosexual women when we talk about pre-exposure prophylaxis or PrEP, they say, oh, isn't that gay drug that you use to prevent HIV? And they don't think that they're candidates for it. And I've actually had patients that I've seen before that could have taken PrEP, but didn't because they thought it was for gay men.
However, there are persons who know they engage in certain activities that they are candidates for PrEP. But the Black women see the commercials on TV and they think they don't even know what the commercial is.
I sit with my grandparents and educate them, because they are single and could be sexually active just like the 15, 20-year-old.
That's a myth
The
in and of
myth
itself.
is that older people
Right.
are not having sex, so they don't need this education. The providers don't think that it's necessary.
Elders are getting it in,
Yes.
so we have to make
Elders are
sure
getting
that just
it in.
because someone is of a certain age that we don't ask the sexual history questions.
Yes.
Absolutely. Our elders are getting it in. And there are beautiful super octogenarians who report that they're still sexually active. And so it is so important to remind them at least of the condom component.
So when we talk about myths, that condoms are the only form of safer sex.
Right.
And I think that's
Right,
a larger
that's it.
conversation, is that we don't talk about sex in the way it's typically used by most people, which is for pleasure. People don't have sex
Correct.
solely to procreate. People have sex because it feels good.
People in our communities and communities at large believe HIV no longer exists. Like, we handled that, right? Like, when we put out the trash, it's gone. And to submit to you this, long before we get to the school, we have the kitchen table. We have gathering of family. And some of us who didn't have family always have someone in community. And it's usually a woman that they can rely upon or taught them something. It is not a death sentence.
What is the biggest takeaway, someone watching right now, this generation, that they should take away from this conversation?
Get your freak on, but get checked. How about
Okay.
that?
Short and simple. What
Short
about
and
you?
simple. I would say, have the conversations amongst your circle, your friends and your family. Don't be afraid to talk about sex. Don't be afraid to talk about HIV. Let's start breaking the mold now.
It starts, one, with loving yourself. And if you don't love yourself, hug yourself every morning and say, I love my beautiful Black self.
Amen.
2,
Amen.
get it how you want, when you want, as long as you want, safely. And there are ways to do that. And then 3, we need everyone in America to understand that we must decriminalize HIV.
Yeah.
HIV is not a crime. Miss Grizel, David, Cedric, thank you for this informative conversation. When we come back, we're diving into the Tinder swindler syndrome and why dating app users are falling for romance scams. That's up next.